Hi, everybody. So I'm Rob Parks. I'm the co-founder and CEO of Service Robotics, and today's webinar is really telling you something about the work we're doing to enable this remote care pathway for patient discharge. I don't think I probably need to explain to very many people the importance of this. Pretty much every day there's an article in the news about how hospitals are too full to allow the admission of patients coming in through the A&E route. What we're doing here at Service Robotics is that we are building a solution and have built a solution that can assist in discharge of patients at the other end of the journey. Okay, so just go into the setting the scene. We've got 45 minutes here. We're going to perhaps take 25-30 minutes to present, and then there'll be some Q&As at the end. The GenieConnect platform that we've built is specifically to enable a new era of hybrid care delivery models. So you heard it here first, hybrid care delivery. And that's the way forward, we believe, in terms of the way care must be delivered. And it's the way that we can clear some of those pathways for discharge. Okay, so just one more slide on setting the scene. There are 13,600 medically fit patients waiting to be discharged at the moment in the UK. And actually, there are various reasons for not being able to be discharged, but one of the big reasons is lack of a home care package or even equipment at the home to enable them to live, to become independent and to be re-abled. So that's a big chunk of them, and that's really what we're saying we can address with alternative care delivery solutions. At the cost of roughly £500 a day, that's £180,000 a year for each bed that's blocked, costing the NHS unnecessarily. And of course, you've got the consequential costs as well of people who cannot be admitted quickly enough, resulting in an escalation of their health and care requirements. And just to say, as we set the scene, the solution really here is not to get more carers. Right now in the UK, there are roughly 300,000 vacancies in care, and the people who we need to deliver that care just aren't there. So there's no feasible or credible plan that sees an industry which currently has around 800,000 carers find another 300,000 in short order. So the solution cannot be to get more carers, and we believe the solution is to use platforms such as GenieConnect to deliver this new hybrid model of care. Okay, so here's a brief agenda. The care model introduction, I'm going to go into a little bit of that in more detail. We're going to look at some best practices. We have deployments in reablement already in the UK, and the learnings from those are coming through thick and fast. So there's going to be some examples of care delivery pathways for those people. And then how to plan for the new models in 5 easy steps. That's the sort of sum up really in terms of what we've been talking about. Okay, so introducing a new care model. So at the moment, of course, the home care model is a face-to-face, person-centered and time and task-based model. There are ways in which that is developing, some of them are extremely encouraging around patch care, but potentially, or certainly the digitization of home care itself is helping. And on the other end of the spectrum, we have the remote care capabilities. So there are many solutions emerging for monitoring of health and well-being. But the real benefits to be had are in the middle with a hybrid care delivery model. So a couple of things to say about that. First of all, no one is suggesting that remote care has a part to play on its own. We truly believe that hybrid care is the way to go, because through a hybrid care model, you can increase the efficiency of the way care is delivered. And that is so important in the current landscape of a paucity of care people available. So allowing that increase in in-person care delivery through the integration of a remote care platform with that care delivery solution is really what we're talking about. And with customers that we're working with, which are local authorities in various counties in the UK, we're showing them how using this hybrid care delivery system can lead to a 15% improvement in the capacity of care delivery. And that's just the beginning. So that really is just assuming that Genie helps, enhanced or accelerated discharge of roughly a quarter of the people that are waiting. And that in itself gives a 15% improvement in care delivery capacity. Okay, so what are we talking about then? And I'm quite aware that the questions that must be burning in a lot of your minds is, what are we talking about with Genie? So our solution, I'm going to go into this in a little bit of detail. Our solution, Genie, is a small companion robot. Genie is typically used in a home environment, sitting on a table or a desk, or in a room where the service user is more commonly located. And Genie is the interface for that person to the whole care delivery platform and systems. And I'll go into some of the features in a minute. But there are two other elements to the solution, which is important. The first one, on the left of your picture there, is a companion app. So the companion app is delivered to anybody who is in the circle of care of that individual. For example, friends, family, neighbours, but also carers on the move, clinical professionals, healthcare professionals, those kind of scenarios. So as part of the circle of care, those people with the companion app will have direct access to the service user. And then the third part to the solution is the care portal. And this is a portal through which our customers, which are mostly local authorities or care providers, the care portal is what they use to manage their fleet of robots. And by doing that, they can interact directly with any of the users. They can collect statistics and data on the population as a whole, the Genie population as a whole, and they can individually edit reminders and mood capture responses for individual users and add appointments in. If you're on the move, if you're a carer on the move, you can also do that through the companion app. So, for example, you can use the companion app to go into the calendar of the service user and look at their calendar, add items, change items. You might be, for example, saying, putting a note in saying, I'm running 10 minutes late. Please start getting ready for the event that's happening, food preparation, for example. So those are the three elements of Genie, the GenieConnect platform. And bringing it to life as best I can in such a short presentation, I'll just tell you about the main features. So on the top there, video calling. Of course, video calling from the companion app or from the care portal or from Genie to either of those is the way that we deliver that face-to-face remote care. So as a user of the companion app, I can call my mum, say, I've got a contact in my phone called Margaret, which would be my mum, and I will call her, and Genie will announce that the call's coming, and you can answer the call with just a voice or with a touch on the screen. Doing it the other way around, if Margaret wants to make a call to me, she will just either use the voice command, Genie call Rob, or she can go into the Genie menu which has a section for contacts, and just do it that way. There's pictures. It's very easy to use. We've designed the interface so that basically it is easy to use. And then you have a two-way video call setup, which could be for the purposes of a welfare check. It could be to see if Margaret has taken a medication, and if she's not sure about how to do it or what to take, then you can go through it with her on the call. Or it could be a social call, so a friend or family member. And this is really important as well, because, of course, one of the biggest issues with people who are newly discharged from hospital can be loneliness, and can be that isolation, and they feel vulnerable. And if they don't have regular contact, that feeling of vulnerability can escalate. So the very fact that you're able to make a video call with this person is one of the ways in which readmission can be avoided, because you're in constant communication. Other features such as calendar management, I've mentioned that. So you're able to go into the calendar either on Genie or on the companion app or on the care portal and set up reminders such as medication prompts. So Genie will say, Margaret, it's time to take your medication. Have you taken your medication, yes or no? So we're capturing the outcome from that medication check. Hydration reminders, have you taken a drink today, yes or no? We're capturing that. And all of the data from all of these reminders is available for inspection on the care portal, so that you can see as a care provider whether or not somebody is saying, yes, I've taken my medication, or no, I haven't taken my medication. Of course, that's a point with which you might actually put in a call and say, did you run out? Or just to talk them through it and ask why that's happening. And again, I probably don't need to say this, but medication compliance is one of the biggest reasons for readmission and admission in the first place. In fact, we know of people in some of our customers in various counties in the southwest who are being admitted to hospital because they cannot be sure that that person has taken their medication, and that seems like not the greatest use of a very scarce resource. So using these hybrid care delivery systems is one of the ways of cutting that out. Okay, other features on the robot include we have entertainment features. So the purpose of this really is to drive engagement and drive usage of the Genie system. So if, for example, you can ask Genie to play your favorite radio station, or even video content such as Netflix or BBC iPlayer, and if there's a subscription, of course, that's down to the user, but it's all available on Genie. And we have found that in our deployments where we have users that are using Genie for some entertainment, it could just be an Audible book or something, almost trivial, but if they're using Genie for entertainment, then they are much more likely to engage with Genie for the really important tasks, such as the reminders and prompts. Finally, the other feature that we have just implemented, which was for 2 customers specifically, is a directory. So the service user has a directory at their fingertips of all of the local services that their care provider wants them to have access to. This could be anything from a local taxi service to a kind of meal delivery system, to Blue Badge application, to phone numbers for their GPs or other services in the area. So by doing all of this, what we're actually doing, considering that most of the people who are discharged from hospital in a reablement scenario are older adults, we are actually enabling them digitally to be independent and to be able to access resources without having to send somebody to their home to go through it with them. So that's something we've just enabled. And I want to mention one more thing, and that is a feature that we call Genie Buddies. So if you have Genie users that are in perhaps the same local area or under the care of the same care provider, it is possible, based on consent, that they can be connected to each other via Genie, and they can build relationships like that. So this is a loneliness and social social capability that, by doing that, again, reduces the likelihood of readmissions due to loneliness or due to mental health issues. That's a whistle-stop tour of Genie, and I hope it goes without saying that if anybody wants to have a more detailed look of Genie and have a look at the robot themselves, then we'd be delighted to book that with you and take you through all those features and give you a demonstration. But as a part of this webinar, I just wanted to go through that and then just talk to you now on the next slide about the first of the reablement scenarios that we are bringing up. So quite often people who are in a reablement scenario are in hospital in the first place due to an accident or a fall. And this is a case study of Margaret. Margaret is 86. Margaret suffered from a fall which left her badly injured in her shoulder and her leg. Unfortunately, this is not an unusual scenario. And after she had been admitted to hospital and treated, she was referred to her local authority reablement service, which uses Genie. And over what was tentatively a 6-week program, she started with 2 in-person visits a day, plus a daily remote check-in from Genie, and several reminders during the day as part of the remote care for water intake, for mood check-in. So in that case, Genie will say, "How are you feeling today, Margaret?" And the choices are happy face, neutral face, sad face. Again, whatever Margaret responds is captured by our platform and is available to those delivering care to monitor and to see if any intervention is needed. And I think it's fair to say that without Genie, Margaret would have been a candidate for one of the 40% of people who are discharged and then readmitted within a number of days, within 30 days, because of loneliness, because she now has companionship to reduce that feeling of isolation. She feels cared for, and with the additional face-to-face care and the remote monitoring, stuff that can go wrong is avoided, and that's how the scenario with Margaret worked. Okay, so that's one scenario, and by the way, these are just examples. You'll probably all have your own experience of what those scenarios might be, and we've just picked a few to try and capture, the utility of the solution and how it can help. The next one is somebody called Dean. Dean was in the reablement team after suffering a stroke that affected the left-hand side of his body and his memory. At the time, Dean had a lot of domestic pressures. He was supporting his partner who was undergoing treatment for cancer, and so therefore he had the psychological pressure of feeling responsible at the same time going through his own recovery. So he was initially assigned several visits a day, but it emerged pretty quickly that he didn't need several visits a day because of the way Genie was helping him. So he settled on 1 in-person visit per day and 2 remote calls a day and daily medication prompts. He was feeling vulnerable because of the lack of memory, meaning he might forget his medication. So that really helped him. The reablement team assessed his needs, and there was some equipment involved in his rehabilitation as well, and the ability to support Dean with remote calls for things like sort of light physiotherapy, or checking that he'd done his exercises, or even just a reminder saying, did you remember to stand up today or in the last hour, or whatever his care scenario would be. And by doing that, and by filtering these prompts and checks throughout the day, means that, that the carers who would have physically been visiting him were able to apply their efforts to others as well. So, and the thing about this was, it's a progressive care plan to encourage his confidence and to make him feel like he could cope with his independent living situation. Okay, and the third scenario, I'm just going to do three, is one of a disabling injury. So this is interesting because disabling injuries like this can lead to very long-term care consequences. Jane had a serious accident and was unable to walk, and she lost her mobility, so she could use her crutches indoors, but outdoors was a wheelchair was necessary. And importantly, after receiving a poor prognosis for regaining her mobility, Jane became depressed and lost motivation to regain her independence. So there was a mental health issue, as well as all of the care issues for supporting her to be independent. So the reablement team assessed her situation and came up with a 6-week plan to build her confidence. One in-person visit per day for 3 weeks, and then moving down to 3 times a week. And what we hear from care teams is that when levels of care in terms of the number of visits a day are first prescribed, for example, you might have a visit scheduled to help somebody get up in the morning, and quite often within a few days of the reablement process, a carer arrives and that person is already up, because they are striving to become independent themselves. And with Jane, her confidence increased like this, and she within 3 weeks she was accessing the community and mobile around the home. And also we were capturing her mood through the mood check, and we could make sure that if she was having a down day, that the support was there, either from friends or family through Genie, or from the care organisation, to address that and to help her to move through that mood event. In addition, as you can imagine, somebody with this kind of condition is also very vulnerable to perhaps exercise regimes being forgotten. So reminders for exercises, also remote calls with occupational therapists or physiotherapists are possible. We haven't done that yet, but with Jane, certainly that would be something that she could benefit from. Couple of other things to mention in reablement scenarios. When we've been working with local authorities, we've had some fabulous ideas about what kind of reminders would suit people specifically, individually. And it can be anything from, is your pain better or worse than it was yesterday? Is your dressing comfortable? Basically, the reminders and prompts can be set to ask anything that is a yes or no answer, and then that can be captured. So in the event that somebody is saying my pain's worse, then of course that allows an intervention, and that information is very valuable to the care organisation. Okay, so I'm going to move on to the last few minutes of the presentation. I'm just going to talk about remote care and 5 easy steps. So we drafted a 5-step plan to make this happen. First of all, identifying the opportunity that exists within the reablement space, looking at the problems that need a new approach. Is it a reablement operation that already exists, but maybe there are staff shortages? One of our customers said to us that they were being called to support people from A&E, so people that perhaps would have been admitted to hospital after an A&E event are identified as somebody that can go straight into reablement. So there's another opportunity to divert resources away from the NHS and into a care scenario where possible. So identifying the opportunity and looking at what the specific scenario is. Secondly, evaluate how many tasks could be done, are required, what tasks would they be, how can we free up the care capacity and not over prescribe care packages. This is quite an important step in the process. We hear about a lot of care packages that are prescribed and over prescribed due to that lack of regular engagement and interaction. And I mentioned one scenario earlier where a carer arrives and they're already up because they've moved beyond that. So evaluating helps that. Review. So we'll help you review your workforce readiness. The important thing to say here is this whole hybrid care scenario isn't just using tech, it's a culture change in the way we deliver care. And one of our customers, which I can tell you because it's in the public domain, is Shropshire County Council, and they adopt a tech-first approach to reablement and to care in general. And that's because they understand that it's a culture change and we have to work with all of the stakeholders in a care delivery organisation. And that's exactly what we at Service Robotics will do. Prepare personalised service demonstrations and an implementation plan. And then on the implement, we typically do workshops with the reablement team and the wider professionals involved, such as ICS or ICB colleagues, the OTs or the assistive tech departments. So we are very keen to help with this engagement with the wider community in an operational sense, because these kind of platforms work very well, but they do require support and they do require integration and they do require a cultural understanding of the way it shall be used. And then finally, impact. So we will help to collect outcomes through our dashboarding systems and our care portal, outcomes that allow us to further enhance care quality, to measure how we're doing, review the impact on demand, the impact on service users and the impact on the workforce. So those are the sort of 5 steps that we have identified. And also, just before finishing the sort of formal part of the presentation, if you like, I just want to say that this is all very new. So hybrid care model delivery is a new concept. You heard it here first. I think I said that before. But there are benefits that we don't fully understand. Every time we meet with a customer, they see 3 or 4 other ways in which this kind of platform can be used to the benefit of the service user and the efficiency of the care delivery system. We're always open to discussions and ideas, and the great thing about the platform we developed, it is ultimately flexible and can be tailored in any way according to the requirements of the users of the system and the service users themselves. Okay, so we're into a Q&A session, and I wanted to allow enough time here to capture any questions that come up. We're sort of demonstrating Genie a lot to a lot of people, and there are generally a lot of questions about what it does, how it does it, what it can do, what it should do, could do, all those kind of things, and concerns about other elements of the implementation of hybrid care. So I'm going to ask Tammy to kick off and help me interpret some of the questions. And perhaps if you just front them up so that I don't have to simultaneously answer them and read the chats.
Yeah, no, not a problem at all. I've collected them. Some people from the NHS haven't been able to join today, so we'll send them the recording. A few have asked some questions for you to answer now. The first one is, what happens after 6 weeks? What do you do with Genie?
Yeah. Okay. So yeah, a classic reablement period of 6 weeks. Sometimes it's less, sometimes it's more. But our experience so far in Shropshire in particular is that the reablement is funded for 6 weeks. The Genie, however, is funded for a year. And then what happens after the 6 weeks is that that person is assessed, their needs are assessed, and if it is deemed that Genie can be an important part of the way care is delivered beyond reablement and supporting them in their continued independence, then it will be transferred to a care provider to use. And in the case of Shropshire, they're actually commissioning care through both Genie and face-to-face. So, and I think that's the first in the country, commissioning care remotely as well as face-to-face. However, if at the end of that 6-week period, it is deemed that that person is fully enabled and they don't want or need any more, then the Genie would be reallocated to the next referral from the reablement list.
Thank you. One from Karen. Who has funded the use of Genie so far?
Funding is a big one. Our very first deployment was actually in the field of adults with learning disabilities, and that was funded through a disabled facilities grant en masse. Again, this was Shropshire. This was the first contract we had with them. And then after that, on the reablement side, they're being funded through local authority budgets. And in particular, I think there's a lot of interest at the moment since the government's announcement of the 500 million extra for hospital discharge support, 200 million of which would be for local authorities. So there's an application process for that. And we believe that a hybrid care model option is a very strong addition to an application for that funding. I think the slightly disappointing thing is that the savings to the NHS are absolutely enormous, but so far reablement is funded through local authorities and not through the NHS. And we hope that will change, because at £500 a day for a hospital bed occupation, it makes perfect sense to be using whatever tools you can to accelerate your discharge.
Thank you. Another question, it says Tammy Whalen Blake. I'm not sure who this one's from, apologies. It's, how are observations shared with MDT? Do you know what MDT refers to?
I can't picture that, no. But observations, I can answer the question in a sort of general sense. If multidisciplinary teams, there we go. Thank you. Yes, so all of the data that is captured by the system is available on the care portal. In the case of a reablement event, the responses to prompts, so let me give you an example. Margaret has said she has not taken a drink. So Genie has said, did you remember to take a drink today, Margaret? Yes or no? And Margaret has clicked no. That information is available also on the companion app. So anybody who's involved in the care of that person can see those responses at any time. But to back that up, there's a system of reporting that we have implemented. So in the event, for example, of a adverse answer to a hydration or nutrition event, a report can be sent, or an alert can be sent to whoever is in that circle of care. So basically, it's configurable. You decide how many people should be receiving this information, and we set it up to do that from the platform in the back end.
The next question from Sharon. is how do you support the workforce culture change?
Yeah. Well, we've been deploying Genies for a couple of years now, and I've got to say the very first few were difficult because we didn't understand, the importance of doing this. So we get a very enthusiastic, perhaps local authority or care provider, sort of on the innovative side of the adoption spectrum. And then we would go into working with the team to make it happen, and they didn't really feel they didn't understand it, they didn't have the excitement, and they thought it might be one more thing for them to do. So the way we do that now is that we engage with all of the people that are delivering care. So the first thing is workshops for the reablement team. So we did workshops in one case for 2 groups of 20 people, all of whom were in the reablement team, showing them Genie, asking for their feedback, and asking them what they wanted, what they needed, what would be useful. And it does require strong leadership. So in that case, the head of the project was very supportive and very strong in the use of it. So mandating the use of it rather than asking if they wanted to, that's important, because it's part of the culture change is actually being required to use it, both on the side of the colleagues in the care environment, but also the service users. So that customer, for example, uses Genie for every single one of their reablement customers, for want of a better phrase, and it's become part of the way that they deliver care. They call it tech first. I think I mentioned that, but that's what they do.
Perfect. And we have another one here. The care portal appeared to show temperature readings. Do you support things like glucose monitoring?
Yeah, okay. So there are so many opportunities for integration with monitors such as glucose and vital signs generally. We can do that. We just have to be sure that the people that are receiving those readings are qualified to understand them, and that it is part of their responsibility in the care of that person. So sometimes we find that we're actually sort of moving from a social care to a healthcare environment, and that can be difficult if, for example, one of our customers, a Caremark franchise, told us that his carers are not allowed to take blood pressure readings because they're not clinical professionals. So reporting those via a system is possible if it is done by the user themselves, if they're capable of doing it. So there are a few obstacles to navigate, but certainly from the technology perspective, it's all possible. And one thing I haven't remembered is mentioned so far is our roadmap of features and ideas. It's absolutely astounding what we can do to move from reactive to proactive and predictive care delivery. So figuring out what's wrong before it happens. And that's all very much front and central of our plans, and we will do that in the order in which our customers ask for it.
Okay, a final one, and I give you a warning. I'm going to say the A word. Why wouldn't someone use Alexa instead?
Yeah, we get that a lot. Just to couch the response to that, Alexa and similar smart speaker platforms have an appalling penetration of older adults in particular, because generally speaking, and this has happened through COVID, well-meaning relatives have given their loved ones all of these devices, and they fall at the first hurdle because they're not being supported in the way they use it. So my mum is a great example. She does have a smartphone. She reluctantly agreed to have one, and she uses it for telephone calls and text messages. All of the amazing things that she could do with it aren't accessible to her because she forgets how to use it, or she gets confused about which icon to press. So the same applies with other smart speakers compared to Genie. Genie is an interface that's specifically designed to be useful and usable to that cohort, but also it's supported. So we are engaging with the service users either through their care provider or from our own customer support teams. For example, we will put a call in every week to that user and saying, how are you getting on with Genie? Do you need any refreshers, or can I help you set up some reminders? Or, you know, that kind of level of support is what older adults in particular need to get over that adoption obstacle. So the other thing is, we've had comments from some of our users that Genie makes me feel like I'm being looked after. And that's actually quite important as well, because Alexa doesn't give you that feeling. Genie, as a sort of cute anthropomorphic entity in your home through which you deliver care, engenders those feelings of being cared for, which really drives the engagement with the system. I think I've covered the high spots on that. One more thing, actually. Genie is not always listening, like some platforms are, allegedly. So Genie won't listen to anything that's going on in the room until you use the wake word. So that's another difference between Genie and other smart speaker systems.
Wonderful. That's all the questions.
Okay, good. Right. So I'm just going to finish off by saying we're really, really keen to engage with anybody who thinks this could be the answer to the way their organization delivers care in the future. We can, following that conversation, put you in touch with other local authorities or care providers that are using Genie and have some experience in it. So that we found that to be very useful. There are going to be some announcements in the press shortly with some other projects. And geographically, we're not restricted as long as it's within the UK. That's where we want to play, certainly to start with. So please get in touch with us if you'd like a demo, if you'd like a personalised demo. It's just really, an hour on a call, and we can show you the features and figure out, if this is something that could be in your future in terms of care delivery. But I think the chances are that solutions like this will be increasingly adopted. In fact, I have a call with the Department of Health and Social Care this afternoon to go through Genie with them and to talk about how care policy should be reflective of hybrid care models. So I think it's going to be an increasingly interesting and important part of the way we deliver care. So yeah, thanks for joining. Lovely to have so many people, and yeah, don't hesitate to get in touch. Tammy, do you have anything else to say?
I do, yes. As you see on the screen, we would love some feedback. Share your thoughts. What was it like for you? The content, the speaker, whatever it is that you want to feedback to us. So you can hold your camera to the QR code and it will redirect you to a form. Alternatively, you can go to the chat box and I've just popped the link in there. We would love your feedback. That's all. Thank you.
Great. Enjoy the rest of your day, everybody.